and welcome again to all our followers. This is the most viewers we've had for any sessions, so I'm not surprised. You're always one of the most popular guests. So, we just quickly introduce you, Dr. Maria. You are the director of Alta Derma Clinic and also the director of the fellowship program conducted by the American Academy of Anti-Aging Medicine Dubai and the A4M. It's been a great honor to work together, Dr. Maria, for now more than 10 years since I moved to Dubai. And today we're going to be talking about how can aesthetic practitioners and physicians stay ahead of the curve and continue to further their skills and their knowledge in this sphere. So thank you again for being here today. So my first question to you, Dr. Maria, is tell us about your own journey. Where did it start and what were the major milestones that you met in order to get to where you are today?
Well, basically it all started in 2002. And actually it was for personal reasons. I was exhibiting obvious signs of aging. And I started out as the clinic, which was called Aesthetica, which still exists, I think. And at the time, basically, aesthetics was in its infancy, especially in this part of the world. People were apprehensive of the slightest intervention, even the mildest peel. And actually, at the time also, people thought that the only route to rejuvenation was a surgical facelift, that they would wait until such time that they would undergo surgery. Then came the big aesthetic boom, and there was a lot of action, a lot of developments until, let's say, 2010. It was growing at an astronomical speed. So I spent a lot of time researching treatments that were evidence-based that I could introduce in the clinic. It was very interesting for me, the whole learning curve. Doing that, I was able to secure agency rights for the Middle East for many lasers and energy-based devices, injectables, and cosmeceuticals. So that started up an independent company called Callium, which had offices in the Middle East. And then Sirvan, you came from the UK representing Tarsus and asked me to head the fellowship program for the A4M. And since I have a background as a professor in academia, that of course is my main interest. Teaching is really my primary interest. So this is when we set up the Institute of Medical Aesthetics in 2011 and started the training programs there. And of course now we are doing them here at Alta Derma Clinic and Academy. So those were the major milestones.
Wonderful. Thank you, Dr. Maria. And I love how you're highlighting the personal needs that arose in 2002. And I've seen this happening with so many practitioners who actually get into anti-aging medicine as well. So very often it's a personal need, and then you start studying, and then you decide to integrate it to your practice. So I think this is one of the most beautiful paths that you can imagine. So today you are still an active clinician, Dr. Maria, working every day from Alta Derma Clinics, constantly trying new treatments, combining new protocols. And what would be your advice today to all the aesthetic practitioners out there that are entering this sphere or who have been in the sphere for a while and want to be at the forefront?
Well, for those that are starting out, I would strongly advise that they take one step at a time. They perfect whatever they want to do to the utmost. For example, let's say if they're going to work with injectables, they make sure they're very adept at the technique, they know all the nuances of the technique, and not try to juggle too many balls at one time, if you know what I mean. Not try to do a lot of lasers and injectables and all of it at the same time, face and body contouring. So take one step at a time, but make sure that each and every treatment that you introduce in your practice, you have perfected. Because people will not appreciate mediocre results. There's so much competition out there. This is now, the situation has changed a lot dramatically nowadays. And now people know that The most important determinant for patients when they want to seek a practitioner is the reputation of the practitioner. Not the social media, not this, not that. I know these play a role, but basically it's the reputation and the results that that practitioner can afford. So you must make sure that clinically you are up to scratch with each and every treatment that you offer in your practice and be ahead of the game.
And not to be mediocre. And
Yes.
do you think nowadays it's essential to integrate lasers into your aesthetics practice? Because I see a lot of aesthetic physicians that, yes, that they're following this advice. So let's say they're focusing on injectables, but they haven't started yet getting into the field of lasers. We know that this is the big sphere of aesthetic medicine and the future probably as well.
100%. But then again, it depends on the practice because lasers require a large capital outlay. But in my opinion, you cannot have a holistic approach. You cannot cover all aspects of skin aging with only injectables. And in fact, we're seeing a burgeoning market in these boosters that are coming every day. There's another booster coming out and promising people that they're going to restore the skin just with this, which basically are hyaluronic acid injections, maybe with or without amino acids. So the practitioners, the onus is on them to research these products, to look at the literature, to find out where is the evidence that these boosters do much for the skin long term. It's a flash in the pan. So what really improves skin health, what really restores skin are the energy-based devices. So there's no really long-term proper anti-aging or treatment of scars, let's say, treatments of wrinkles, dyschromias without the energy-based devices. So if you want to offer the full spectrum of treatments, you have to incorporate lasers. And these definitely have a longer learning curve than the injectables. Another reason perhaps why some people are apprehensive.
Absolutely. And I want to talk very briefly about the science of lasers, because there is often, I've seen the misconception, let's say, that we can get a quick training, from the manufacturers and the distributors of the devices, which is very important and essential, of course, to know how to use the parameters and the device to the best of its abilities. But there's a whole field as well of science and physics when it comes to lasers, doesn't it? That physicians are really encouraged to look into.
Absolutely, absolutely. I strongly believe that any person starting out in this field must have generic training in everything, in lasers, looking at the background, looking at the basics, at the physics, as you say, even with the injectables, looking at generic training, not influenced by commercial bias. This is super important to have that as a groundwork, and from then on you add, for example, industry-directed training. Definitely, as you say, you need to know about the lasers that you personally want to purchase, but you have to understand the principles of lasers. You have to understand what are the endpoints you're looking for when you are treating a patient with laser for each and every condition. So definitely, and in fact, only last month I was at a congress, which is the first, to my knowledge, that actually are totally non-commercial. It was a complete 3-day conference called the Season, which was CME accredited by George Washington University, that had absolutely no commercial bias. And this tells you how important it is for us to understand the fundamentals and the science behind what we do, which is often, unfortunately, forgotten. And people get influenced by the salesperson. They think something is good, it works well, without really spending the time and effort to research it themselves.
Yeah, absolutely. So let's continue to talk a little bit more about the academic side of the industry, and what is the advice that you give specifically to physicians then when it comes to their academic journey in this field?
Yes, as I say, start off with a generic course. A course which is not influenced by financial bias, a course that can give you the basic tools, the do's and don'ts, the cautions, the safety of the procedures that you want to adopt. And thereafter, definitely, learning never stops. We learn every day. So they have to always keep abreast of new developments, and at the end of the day make up their own mind as to what makes sense to them scientifically or not. For example, attending conferences is very important. You always pick up new things. You always pick up, nuances of what you're doing, but you didn't know about. So conferences, even industry training is fine. You have to be exposed. And of course, a lot of reading and a lot of research on PubMed to look at publications on the treatments that you want to offer and see whether there is evidence for them or not. This is the onus is on the practitioner.
This whole topic of reading research is very interesting as well, Dr. Maria, because I remember us having a conversation recently about sometimes even the complexity of reading the research properly and making sure that it's the right interpretation as well of the papers. So I think you have some tips maybe to give on this as well.
Yes, definitely. You must make sure that there is, again, no commercial bias. Who's after the publication? Is it driven by the company making, for example, the product, let's say? Look at what level of evidence the paper is. And all of these things are important. So, not just look at the brochure or listen to what the salesperson is telling you. That's definitely not enough. And remember, you wouldn't want to use a treatment on yourself that has no evidence, let alone your patients.
Yes. And PubMed is your go-to place for that, right?
Yes, definitely, yes. I mean, if you belong to a society like I belong to the Royal Society of Medicine in the UK, we have the online library. Maybe a lot of doctors have this kind of access. I have online library to the RSM in the UK, so I can access any publication that I want.
And what would you advise to physicians maybe that have interesting data and they're thinking to get into research and writing papers themselves?
Yeah, definitely. Why not? I mean, unfortunately, there is a paucity in that regard from this part of the world. Very few doctors publish from the Middle East for some reason. Nowadays, we're seeing these big group publications, 10, 15 doctors, giving consensus recommendations and so on. But actually, as original research, or even they could publish on retrospective data. Say, for example, they treated groups of a number of patients with a certain treatment. They can look and analyze their data retrospectively and write out the information. I'm sure there's a lot of value in what people are doing, but they just have to collect the data, analyze it, and interpret it.
And to share it.
And share it, exactly.
Yeah. So hopefully we have some followers listening today getting inspired by this and wanting to share some of their results as well in papers in the future. Moving on to the topic of working within the clinic and constantly answering demanding patient expectations and being on top of your game, basically. What do you think are the most important skills that aesthetic practitioners nowadays need to display when they work in a clinic?
I think the single most important thing, apart from, of course, the skills in terms of the perfecting the treatments, are communication skills. Effective communication with the patient, making sure that the patient has realistic expectations, sounding out the patient at the end of the consultation to understand what really they expect from the treatment. Because we know a lot of times it's a question of perception. So we have to be able to communicate the facts. We have to be able to communicate what the patient is supposed to expect from that treatment. Things like also even what financially it will cost them before you shove them into a room, and start working on them. So good communication, compassion, being able to empathize with the patient. This is very important. Proper follow-up. All of these things, because now, and especially in this climate of mushrooming clinics, we know that patient retention is of the utmost importance. And how can you have patient retention if you cannot communicate effectively at all levels with your patients?
Yeah. And is it something that is innate communication, or is it something that you constantly work on?
Good question. I think definitely there is an innate quality, but I think even if you are not a communicator, you can be taught and you can learn how to communicate. I'm sure you can. But again, and even for example, something like compassion is innate, definitely. Do you really feel with your patient or not? But then again, verbalizing concern doesn't have to be an emotional thing for you, it can be a skill you can learn. And things like that. I mean, you should have a proper system in place to help you to do all that. For example, even communication can be a simple thing like preparing small presentations of the treatment that you want to offer, showing it to the patient, what it means, your own results, what it will look like, So because we know that a picture speaks 1,000 words, so you can communicate in that way. There are many ways of communicating with the patient.
Communication via education, and you do it yourself, and I think this is a great idea to integrate in your clinic. Just have an iPad on the desk and have a few slides, like you say, pictures speak 1,000 words, and patients love to see them, and you explain in simple terms what the procedure is about, and it's quite engaging as well with the patient. So there's many different ways of deploying communication skills, working on communication skills. The most important is firstly to be aware of it, setting an intention, and then working on it as well and learning from your mistakes.
True. And one thing that I've realized over the years is that many of us often don't have a realistic vision of what we look like in a physical sense. You know what I mean? So, for example, we're seeing more and more patients who are asking to be filled more and more, bigger and bigger lips, and they're not seeing the outcome of what's happening. So part of our education with our patients is that they should look natural at the end of the day, because we are seeing horrifying visions of iatrogenic faces, which are induced by doctors, faces that never were there in history. So this is our job at the end of the day, but we're not doing a service to the patient by creating these monsters. But the problem is the patients don't perceive this. They see themselves every day. They don't realize what's going on.
Yeah.
So our job is to educate them that when we do something, it should be natural. People should not be able to point out to your cheeks or lips and say that, oh, she's done her lips or she's filled her cheeks. It should be undetectable. The patient should look rested, should look good without being obvious.
And you should know when to say no.
Sorry?
And you should know when to say no to your patients for something that you don't agree to.
Definitely. And not be pushed by, let's say, the financial side of pumping more fillers and this ethics. Ethics is beginning to wane away these days.
Definitely one of the top skills, along with communication, good ethics.
Yeah.
Okay, so last but not least, what do you see coming up? There's always the question, what's new in the aesthetic field? Which trends do you think will be happening? And how do you think the aesthetic industry will be evolving in the next few years?
I think we expect more in the energy-based device market. Definitely there are more fillers coming up, but they're all same, same like what we have. We have more hyaluronics just with different trade names. We have more boosters with different trade names. Now the biostimulants are becoming more popular. Again, there are copies of what was there before. But with the energy-based devices, there is room for more innovation. The body market is a big one. The body market for two reasons. One, in terms of treating scars of, let's say, bariatric surgery with people who have lost so much weight where they have nothing else to resort to but to have surgery to remove the excess skin and are left with a lot of scars. So a lot of developments in terms of scar treatments with energy-based devices. And now we are seeing conferences dedicated to scars. This is one thing. The other thing is devices that can actually treat adiposities in the body, for body contouring. I think this is the thing. There's more interest now for people to be able to contour the body non-surgically, because again of the probability of getting quite horrendous scars most of the time.
Interesting. Okay, Dr. Maria, thank you so much. I think there's still lots of new things coming up for aesthetics, although sometimes we feel like there's a plateau, but I think it's constantly evolving and the focus goes from the face to the body, and there's always new areas to treat, new ways of treating as well. So thank you so much for being with us today. We'll open the session to questions. If anybody has questions, we still have a few more minutes. In the meantime, maybe you can tell us when is going to be your next training session, Dr. Maria?
Our next training session is at the end of January. I think 25th.
End of January.
Yeah.
And is it on the topic of fillers or lasers? What are you training
Actually, we have 4 days for injectables, upper face and lower face, including a theory and hands-on sessions with models to be injected by every participant.
That's great. So I think what's very important is to be aware that there is a beginner level and there is an advanced level, which I know a lot of physicians don't always think that this is essential, but there's a lot to learn in the advanced injectables course of A4M. And I think this is where the opportunities are in the market as well, to have more advanced, confident aesthetic practitioners. So I would encourage everybody to join this. We have a few questions from the audience. How do you manage, do you see more male patients, sorry, we have a lot of questions. Do you see more male patients looking for aesthetic solutions, and what treatments?
Well, we personally do not have, in our clinic, we don't have many male patients, but I hear that it is a growing market elsewhere. Probably, I would believe the main treatments again are permanent hair reduction, let's say for backs, chest, and so on. Not that many men, I think, would like to do fillers, although there are some. Probably Botox, scars, of course, for those male patients that have had acne in the past and are left with atrophic scars. They would probably opt to undergo quite aggressive laser treatments to treat the scars. So I think these are the main things for men.
Okay. And then we have another question from Nada. Given the evolving technologies and trends, how do you balance incorporating new techniques in your clinic while ensuring a high standard of patient care and safety?
Well, it's always been our policy when introducing any new treatment, or we have to evaluate the treatment initially. So we do in-house studies, pilot studies, we try out on volunteers, on ourselves, we make sure the parameters are optimal before we start to adopt it on our patients. So we definitely have to have a trial. We must be sure of the efficacy and the safety of the treatment prior to subjecting our patients to that particular treatment. So we need to be convinced. And then, for example, let's say when it comes to treatments that improve skin quality or facial contours, we've always used 3D photography to actually give us an objective assessment as to whether the treatment does what it says it does before we adopt it.
Mm-hmm. So always validate it yourself internally first.
Yes.
Another question we have is, how do you manage expectations in aesthetic medicine? You always used to say under promise, over deliver. I love this saying.
Yes, definitely. No, I think you can be realistic. We often give also handouts with what they have to expect in terms of side effects, in terms of number of treatments required. We state the facts as they are, and this is where our presentations help us a lot, to show them what we have achieved for the same problem that they're coming for. And this will help them understand, and also tracking their results with photography. I think this is super important. We are accountable for their results. If they become our patients, we're accountable for them achieving what we say they will achieve. And this, touch wood, we have been successful in doing by tracking the results of all of our patients.
Yeah, tracking is extremely important. And I remember myself when I was at IMA and trying to track the models, it's a lot of work that goes behind that, you know, following up, making sure they come for the pictures. So you really need to have a team behind you who's supporting you with this. Patients need to play the game as well, come back for their after photos, but I think it's well worth investing in that whole process and teamwork in order to get that data and making sure that what you've delivered works as well.
True.
Thank you so much. Do we have any more questions from anybody? I'm just scrolling through. We've had a great number of people joining today, which is absolutely amazing. Thank you, everybody, for being here. I think we may have no more questions for today. If you have any requests of any other topics that you would like Dr. Maria to talk on for any other live session in the future, you can also drop it in the comments and question and answers box. So thank you so much, Dr. Maria.
Thank you. Bye.
Thank you, everybody. Wishing you a great rest of the day. This was our last Instagram live session for the year. So we'll see everyone again the first week of January. Thank you again, Dr. Maria. It was an honor to have you on this channel today.
Thank you, Sarah. Thank you.
Thank you so much. Have a lovely afternoon. Bye.